Everyone. Yeah, lighting's bad. I've got to get it fixed. Um, I am Allie, Director of TBI Raiders. Yeah, I gotta move this way. They're getting the light. Try to see me better. But anyways, um, kind of tried to get more done this week, but didn't succeed as well. But I got some done. The day I was probably would have gotten done more. I was kind of more geared on staying in the gym, exercising, and everything. So sorry, I was kind of geared more towards exercising on Wednesday. So, but I did send an email before I hopped on to put together this just now to the FEMA Region 6 um, for the dis- oh gosh, disability emergency management and everything. And that FEMA Region 6 for Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. And I sent him a letter to find out more about disability emergency management. Because I also have tabs up on Kansas and Arkansas. Because I might be contacting those two states as well. Oh gosh. I know I got an email from Tally, State Representative Tally. I gotta go and read so I don't forget. Okie doke. This is over the OKDHS Oversight Report. Recently, Governor Kevin Stitt signed a bill that I gladly co authored to help Oklahoma's 4 H students. House Bill 1006 grants 4 H students an excused absence when participating in an approved activity. The author of the bill, Representative Rick West from Heavener, has been working to get this bill passed for 4 years. I have heard from numerous students who love participating in 4 H but can't receive an excused absence for activities that take them out of school, unlike students participating in FFA, athletics, and other school sanctioned activities. These absences mean their grades are often negatively affected since they can't make up missed work. House Bill or HB 1006 would change that and will take effect before next school year. In committee work this week, I passed Senate Bill 1638 through the House Children, Youth and Family Services Committee, which I chair. SB 1638 brings Oklahoma into compliance with federal law and requires that reports submitted to law enforcement about a child missing from foster placement must include a photo of the missing child, a detailed description of their physical features, and information about potential endangerment. The measurement requires that Oklahoma Department of Human Services to maintain regular communication with law enforcement and the National Center for Missing and Exploited Children to provide for the safe recovery of missing or abducted children or abducted child. On Thursday afternoon, the Legislative Office of Fiscal Transparency released a report on adoption and parent support programs within DHS, and I attended the Oversight Committee meeting where the findings were discussed. Between fiscal year 2015 and fiscal year 2023, Oklahoma experienced a 44% decrease in the number of children entering state custody. As of fiscal year 2023, Oklahoma has the lowest figure of children in state custody in more than 2 decades. The historic reduction of children in state custody is largely due in changes to how DHS applies child safety designations. The number of cases designated safe increased 90% in 10 years, with the higher amount of cases designated unsafe being assigned to family centered services rather than state custody. Family centered services offers intervention to families to help them stay together after a safety concern has been identified by CPS. We want to keep kids in their homes whenever possible because removal is traumatic, but we have to make sure we are not doing this at the expense of their safety. For children placed in state custody, it takes on average 17 months to reunify families, which ranked us second to last in the nation in 2021. However, we had the second lowest rate of reentry, which indicates that while reunification takes longer in Oklahoma, its effects are more permanent. Loft found that this could be partially due to the prioritization of family centered services to support families and help solve the root issues. Families working to achieve reunification often face okay, yeah, face barriers to receiving the required services such as transportation, lack of providers, waiting lists, work schedules, and the cost of services, which family centered services assist with. The report included some recommendations to the agency and the legislature, including establishing a better system of oversight. Loft also suggested requiring the Oklahoma Department of Human Services to annually track and provide a report on its public website of service performance metrics. DHS has come a long way, but there is still progress to be made. I look forward to continuing to work with them to improve outcomes for our kids. Thank you for the honor of representing House District 33 at the state capitol, Representative John Talley, Children, Youth, and Family Services Committee Chair, House District 33, Logan and Payne counties. See if I got anyone from Trish Ransom. No, none last week. Okay. And if you go to Twitter and you want to follow the FEMA region that has FEMA Region 6. There is the account at FEMA Region 6. It's at capital FEMAR, lowercase EGION, the number 6. Okie doke. Now to get in, I have everything designated like for months, like themes. For for the month April, May is going to be on health and wellness. June and July going to be on register. Vote. Party affiliation. Got things popping up and I'm trying to get them closed off. As well as encouragement to vote for your candidate. And when I say that, I am not going to tell you who to vote for. That is your business. August. September is going to be on family. And employment. October. November. Veterans. And service members. December. Disability. And then weeks. be focused on, if that makes any sense. Week 1, empowerment and voting. Week 2, advocacy, which is this week. Advocacy and support. Support groups. Week 3, legislation. Week 4, sports ed recreation. And something that the tribe my husband's descended from, but he's not enrolled with, it's his mother's, the tribe she's descended from, that his grandma's Matthews tribe, that she was descended from and enrolled with, the Iowa tribe. They have this fabulous program for those with pre-diabetes and diabetes. It's like for those on Tuesdays come together, and it's about what can I eat, and you learn talk about better ways to eat, talk about healthy eating habits and everything, and they have healthy eating snacks, and they talk about it and everything, and then they have trainers at the gym, which I'm able to access thanks to my husband. They're really helpful and everything, and that they has an app, goes on the phone, and now I can exercise at home, and with the exercises that I could do on the mirror in the little Zoom, the workout room that they have there in the gym and everything, besides all the equipment that they have and everything, besides the Fit On that is the Fitbit, and then the Fit On that I have on my TV and on the phone and everything. So it's very exciting with everything that's going on. So it's with that, I would very much encourage you to not only encourage you, but challenge you to look into your local, see if they've got like Planet Fitness. If you are a Native American, see if your tribe has a gym, or if they have some type of fitness or support group, or do something for, say, like if you have diabetes, if they do something like walking or another like that. And because the tribes that I've gotten to know and everything, they do amazing things and everything like that. And then there's, if you're part of the disability organizations, like the big ones and everything, they might do stuff and everything. And if not, try to be a leader to encourage them to do stuff, or you be the one that steps out and go, hey, get a group of friends and start a movement, do something and everything. So that's all I've got to say for this podcast. So I shall see you next week, which the focus is on legislation. I will try to work on more on that legislation I was working on and everything, and get to contacting more on the states that I need to contact more on for the disability emergency management training. Um, I contacted the main office, and I'll try to contact some states and everything. So everyone have a fabulous day, and I will see you later.